All right, folks, I think we're going to get started. I'm going to kick us off. My name is Nat Kendall Taylor. I'm the CEO of the Frameworks Institute, and just want to say at the top how absolutely honored and delighted I am to have the opportunity to co-host this event with our colleagues at the American Academy of Pediatrics. And I want to welcome everyone who's on. I can't see how many of you there are, but really grateful to have you all join us today. I think this is going to be a really fascinating and important and interesting session. Yeah, just wanted to say a sincere thank you. I know everyone does really important work and time is really valuable. So appreciate you being willing to spend some of it with us here today. And I'm totally biased, but I think what you're about to see is going to be well worth that time. So just welcome and thank you for everyone showing up. I think I want to just say a couple of things to set us up, and then I'm going to hand off to other colleagues. But just want to start by saying that those of us on this call, I think, have a relatively easy time agreeing on kind of the importance of vaccines and the critical nature that they play in preparing children's immune systems to respond to serious diseases. And then just note that there's another part of our jobs, which comes to our role as science communicators, which I think is decidedly less easy and is significantly more challenging as we kind of go about our lives and our work and find ourselves continually forced to respond to harmful ideas about vaccines. And kind of it seems like everywhere we turn, there's another challenge to the work that we're trying to do to advance these messages and achieve these outcomes around vaccines that we're all working to achieve. And that's not to say that we haven't all tried to engage productively and build awareness and change minds on these issues. I imagine each and every one of you on this call has made an attempt and a significant effort in so doing. But that what we find is that when we try to do that, when we try to kind of change minds with the logical solution, which is offering more and more robust scientific facts and information, we all probably have the experience that is less effective than we would like, that the kind of logical solution of refuting myths turns out to not be incredibly effective. And there's really good social science, which I imagine a lot of you are aware of, that shows that these attempts to refute myths, to myth bust, can actually have the opposite effect, can actually make parents less likely to indicate the intent to vaccinate their children. So the question is, if the solution isn't more information from a larger megaphone turned all the way up to 11, what is the answer? And in our work and in the work of others in this field, we found that it turns out that it's not a question of how much we talk about childhood vaccines and vaccinations, but that it's really a question of what we say when we have these discussions. And this really is the kind of opening or the provocation to introduce and bring in the science of framing, which is what we're going to focus most of our time and attention on today. Just again, I acknowledged at the top, but there's never too many acknowledgements for a great partner. Just want to acknowledge again the American Academy of Pediatrics, who has really generously sponsored a study that our colleague Julie is going to take us through here today, which kind of asks two questions: the kind of why is it so hard? How can an understanding of culture and cultural mindsets help us understand the challenges associated with communicating about vaccines? And then really importantly, what are some ways that we can change this conversation that put children really front and center in the public conversation and put public health at the forefront of people's thinking? So that's what we're going to be talking about today. I'm joined by my colleague, Julie Sweetland, who is a senior advisor at Frameworks, whose picture you can now see on the screen, who's waving to us, and is a sociolinguist by training. I've had the absolute pleasure of working with Julie for 10 years now, and over the course of that time, have seen her lead really interesting and important work across a pretty wide range of health initiatives, everything from adverse childhood experiences to tobacco-related health disparities, and a kind of a growing portfolio of work at Frameworks that Julie has really led in a highly effective way around health equity. I also know Julie and have seen her present many times, and know that what you're about to see will be an awesome combination of both really provocative and challenging ideas and incredibly practical, down-to-earth and concrete examples and practices that we can use. So after Julie takes us through a review of the research and its key findings, we're going to be joined by, who you can also see on the screen, Donna Mazik, who's gonna take us through some responses and reactions to that research. Donna is a registered nurse and nationally certified school nurse. She currently is the executive director at the National Association of School Nurses and has served as the president of that organization in the past. Donna and her organization and frameworks are partnering on another project that's really focused on building, understanding and building vaccine confidence. And Donna's role, among others here today, is going to be as kind of an early adopter of some of these findings that come out of this project. And really looking forward, Donna, to hearing your comments after Julie. But before we get to that, before we get to Julie, and before we get to Donna, before we get to having some chance to answer and engage with the questions that you all have, which I would encourage you to put in the chat as we go, I will monitor and moderate some discussion. Before all of that, we're joined by Dr. Sandy Chung, who is the 2023 president of the American Academy of Pediatrics. Dr. Chung is a pediatrician and has held more state and national leadership positions than I can go through, but those include being the president and founder of the AAP Virginia chapter and being the medical director of the Virginia Mental Health Access Program. She has really kind of forged a career in leadership around ideas of political advocacy, and has really been central to major advancements in the field around health equity and optimal child health policies, all of which make her the absolute perfect person for us to hear from first today. So thank you very much for joining us, Dr. Chung. And with that, over to you.
Well, thank you so much, Dr. Kendall Taylor, for that wonderful warm welcome, and completely agree that what you're about to hear is really very foundational and very important for looking at how we can frame the message for vaccinations differently, so that hopefully our families will encourage, everyone in the community to be protected against important things like COVID-19. So thank you all for taking the time to learn more about this new research from the Frameworks Institute, which we are obviously doing in partnership with the American Academy of Pediatrics. And as pediatricians, I'm a general pediatrician, we all know the importance of immunizations, and prevention's at the core of what we do in pediatrics. And we also know there's no medical intervention that prevents diseases as well as vaccines. We know everyone, all the children and all the people in our communities will be healthier when everyone is vaccinated. Pediatricians and family physicians, other healthcare providers, we talk with families every day about vaccines. And when we're talking with them one-on-one, we know that we can build on our long-term trusting relationship to help parents see the benefits and the values of vaccines to keep their families healthy. But we also all must have these conversations outside our clinic walls, which is where all of you come in. What we're hoping to do now with this research is to create a fundamental shift in how the public views vaccinations. That's an ambitious goal and one that will take time, but it's one that's essential. We want to build up public confidence in immunization so that we can increase the support of policies that'll improve access to vaccines for everyone. And the Frameworks research that you're about to hear from was designed to support conversations in the public square. So places where we're communicating with mass audiences, such as during media interviews, social media platforms, or when talking with groups of parents or policymakers. I had the opportunity actually to use this framing recently in a social media interview. And it does take practice, but once it's done, I think it was very well received. So I would encourage you all to try this new framing. We at AAP, we look forward to working with all of our partner organizations and fellow immunization advocates to continue helping the public to understand and appreciate the value of vaccines for all of us. So thank you so much for giving me an opportunity to say a few words. I'll now turn it over to Dr. Sweetland. Thank you.
Thank you, Dr. Chung, and thank you, Nat, for kicking us off. It's so good to see so many familiar faces here on the participant list. Thanks for making time today. I also see a lot of folks that I think we haven't been in conversation with. So I just wanted to introduce Frameworks just for a moment. We're a nonprofit, a group of social scientists. Our mission is to help folks like you with your mission through the power of framing. So we conduct original social science research and provide strategies and support in using that research to advance the nonprofit sector's capacity to frame the public discourse on social and scientific issues. So while I've have the privilege to share the work today, I just want to acknowledge that I am sharing the work of a team. This is work that was research that was led by my colleague, Dr. Patrick O'Shea, as well as many, many folks here on our research team here at Frameworks, and all this was conducted, as Nat mentioned, in partnership with the AAP. But this is a really important project for us. While we were not at Frameworks happy to see the conversation about vaccines kind of go vitriolic, which was happening well before the pandemic, we were delighted when the American Academy of Pediatrics approached us to partner up on figuring out how we might apply the power of reframing to this issue, because we believe that the stories we tell are dress rehearsals for the policies society will endorse. And if the conversation continues to devolve into blame, shame, and misinformation, that's really going to continue to shape the policies that are passed. So we need to reclaim the issue. And voices for good public health and good science need to be equipped to change the conversation. And specifically, the research that we're doing is about changing what we might call the cultural surround sound. Framing strategies can help pediatricians and other health professionals be effective messengers when you're beyond those clinic walls. So to boil it down to fewer than 280 characters, these are all framing strategies made with your friendly neighborhood pediatrician in mind, but they aren't just good for social media. They're appropriate for any type of public discourse, whether that's writing an op-ed, testifying to a legislative community, giving an interview on a local radio station or podcast, or even just offering your perspective at the dinner party. In all those situations, you as a healthcare professional are a trusted messenger, but your science needs more than just you as the messenger. And the science doesn't always speak for itself. Our science needs social science, and our strategic change efforts need strategic framing. So the studies that we've done, as we mentioned in our approach, we typically work through two major phases. First, we uncover empirically how people think now. That's our descriptive phase. And then we work into a prescriptive phase where we figure out effective ways to spark new thinking. In this project with AAP, we started by getting the science down, identifying key concepts that experts like you believe the public needs to understand to play a more informed role in democracy and be less susceptible to misinformation. In the case of this project, we did that by interviewing vaccination experts to distill the big ideas of the field. And we presented that analysis to a panel convened by AAP and adjusted it based on feedback. We also conducted a review of the literature on the communications aspects of vaccination, with a focus on public attitudes and interventions that have been designed to shift those attitudes. We did in-depth interviews with the public and used a technique called cognitive analysis to surface patterns in talk and identify those assumptions that show up again and again. We compared what the experts believe about vaccinations with the public's understanding, and to develop a set of communications tasks and hypotheses. What assumptions do we need to shift? What framing strategies might work for that? Where does the public lack a mental model, just doesn't have a way to think about or doesn't understand something? We need a new understanding that's built up. What type of framing strategy might work for that? So we systematically look at what needs to be done, generate hypotheses about how to accomplish those outcomes. And then we systematically test those hypotheses and tools. First, through a small set of rapid interviews, which you'll get some peeks into today, in small group settings, like a little bit like focus groups, and then in larger scale, randomized and controlled survey experiments that use a nationally representative sample. All told, this project queried over 9,500 Americans and reviewed over 200 studies. In the testing that we did, so here are some of the examples of the outcomes, or the communications outcomes we were testing for. We were checking to see, do the frames work? Well, this is what I mean by work. They would make people more likely to agree with outcomes like these. And these are just a few examples. So more accurate knowledge that a vaccine is effective if it prevents a vaccinated person from getting seriously ill with the disease. Attitudes that we as a society are responsible for making sure that all children get vaccinated, and policy preferences, not a specifically named, legislation, but general directions in policy that we wanted to make sure people would support through the frame. So we should set up federally funded vaccination centers that operate year-round in every community in the U.S. So you'll notice that none of those outcomes were about individual willingness to agree to vaccinations. Again, this project is designed and tested for cultural communications, not necessarily clinical communications. Some of our recommendations might work with patients, but if you're using them in that setting, please know you're using them off-label, and you should pay attention for potential side effects that aren't quite what we tested for. And in some cases, the recommendations I'm about to share for engaging in public discourse may contrast the advice you've encountered for motivational interviewing or other ways of counseling patients and families. And so as a researcher, that makes sense to me. You ask different questions, you test for different outcomes, you'll get different findings. I'm sure we all can appreciate that at a theoretical or intellectual level. In practice, if you're a healthcare provider communicating in a lot of different settings, sometimes with families and patients, sometimes with a political staffer or an interview of a reporter, it might require some fluency in shifting from one framing approach to another. I think Donna will have a little bit to say about that later. But all right, that's the setup for now. I want to start to give you a peek into the research setting, some of the findings and the recommendations. I'm going to begin with a short compilation reel. It's about, maybe close to 2 minutes long. And these are little snippets from the interviews that we did while we were asking people their general assumptions and understandings about vaccinations. This is before we've offered them any framing. This is what's out there in the cultural setting right now. You can read the fuller study. This is just a taste of the research, but I think you'll find it really interesting and a sense of what we're up against when we're looking to build vaccine confidence.
What comes to mind for you when you think about vaccines?
Providing some sort of shield in our bodies
to protect you when something tries to invade your body.
To resist or fight off an infection of some sort.
Attack certain illnesses.
Build an army to counteract that virus in the future.
Controversy of people who want vaccines and people who are against it.
Divide the country between the vaccinated and unvaccinated.
It's just a big campaign, and that nobody really cares if it actually is safe or not.
But I think it should be an individual choice.
We should have the right not to take it.
That's for each person to decide on their own.
You want to get vaccinated, you go ahead and get vaccinated. If not, and that's okay. I'm not here to judge anyone.
So how would you explain what a vaccine is?
Vaccine is a form of medicine.
Some sort of medicine.
Medication.
A medicine.
Medicine that protects against some sort of illness.
And how would you explain how a vaccine works?
I think it has like somewhat of a strain or something of the virus inside, like the vaccines.
Introduce the virus into the body, so they actually give you the virus.
Basically inject small amounts of viruses.
A form of the virus that they put into your body to teach your cells how to fight off the actual virus.
Like a dead portion of the virus that gets injected into you. And then your body builds antibodies.
How can we know if a vaccine works?
Trials.
Clinical trials.
It is tested in the labs and things like that.
Trials and scientific studies.
Without actual testing and results, you won't really know for sure.
clinical trials initially, and then over time, I think.
But I do feel like it will take a while for us to really know if it's working out.
The transmission rates go down, the death rates go down.
And they cease to get them in the large numbers that they were before they got the vaccines.
Over time, if you can see some of those illnesses go away.
What are the risks of vaccination?
The potential risk, especially with the newer vaccinations, I think it's just the unknown.
The risk of vaccinations is the unknown, not knowing.
There's always a risk involved, I guess, in you having a very adverse reaction.
You could have some adverse side effects.
With anything you're introduced into your body, there can be side effects.
Allergic reaction, or they have a pre-existing condition whereby the vaccine may interact negatively.
So in your mind, what are the benefits of vaccination?
Personal protection, it keeps you safe.
Protection for our bodies.
A certain level of protection.
Your body gets a chance to build up an immunity to something that could be life-threatening.
To prevent you from getting sick, or if you do get sick, it's not as severe as it would be.
The original definition of vaccine was something to prevent disease.
It is to prevent disease.
The benefits of vaccination are like herd immunity.
The more people that are vaccinated, the more that we protect each other.
To protect as many people as we possibly can from illnesses that could potentially be devastating.
So the benefits are a healthier population.
As a society, we need to also not infect others. To keep society safe as well.
So that's just a peek into the sorts of understandings, attitudes, explanations that the ordinary people have thinking about vaccinations. You can see that at the beginning, people really did talk a lot about risks, and we see risk taking center stage in thinking, and we'll talk about that. We see a lot of individual concerns that there's a sense that it could be a problem, could have side effects, could cause allergies, could cause unknown issues, and that was often a source of concern. But we also see parts of public thinking that we can make more robust, that we can remind people of, that we can pull forward in the conversation around widespread immunity and our responsibilities to each other. And so in general, if I had to summarize our overall framing shifts that we recommend for the field, and in a short format, I would say we need to say less of the things on the blue side and say more of the things on the plain side of the screen. So instead of talking to folks constantly about how the benefits outweigh the risks, moving more firmly into just emphasizing the benefits to the common good is an important shift in the conversation. Instead of talking about only their rates of uptake, looking at disparities in uptake, shift the emphasis slightly to our shared responsibility for providing equitable access to vaccination services. Instead of mentioning only and always that vaccines keep us and keep kids protected from disease, we found it was important to make the benefits more concrete by pointing out, yes, of course, it prevents disease. And what that means is that kids can stay focused on their developmental tasks, learning, playing, growing, thriving. And in general, because people have an incomplete, sometimes inaccurate, and sometimes just outdated understandings of how vaccines fight disease, and because there's so much thinking about risk and fear attached to vaccines, we're recommending shifting much more intentionally to a story that's about the immune system and how immune systems prepare themselves with a bit of a nudge, right, from the vaccine. So that's the big picture of where I'm going, and we'll dig into each of these in turn. So key recommendation, and Cameron, my colleague Cameron, has put in the chat the full report, all this, there's lots more there, but here the first recommendation is that for public square communications, focus on the collective benefits and collective responsibilities to children and adolescents. We need to shift thinking towards the tangible collective benefits of childhood and adolescent vaccination. And that involves engendering a sense of our collective responsibility to young people and connecting that collective responsibility to doing our part in preventing the spread of infectious disease. In general, as I'm sure you all know, the American public's understanding of health is very individualistic ideas. It's about what health entails and who's responsible. People think that health is a matter of individual choice and willpower, rather than thinking about the broader community-wide or society-wide impacts that affect health. And when it comes to vaccination, this individualistic approach gets in the way of understanding the broader benefits that vaccination, and particularly childhood and adolescent vaccination, have on communities and society. So this is the recommendation where we're probably advising something slightly different from what some of you may have learned about effective one-to-one vaccine counseling. In those cases, it can be important to it's important to meet the individual's needs and concerns and be responsive to those. But in public square communications, framing childhood and adolescent vaccination from the outset in terms of collective benefits can help to avoid the uphill battle against individualistic thinking. To make the case for a public response, we need to talk in terms of public health, society, community. So instead of focusing your commentary or social media posts on how vaccination protects the audience's own children, talk instead about the benefits of childhood and adolescent vaccination for the common good. Help people recognize and visualize those abstract community-wide benefits. We can't completely avoid mentioning individual experiences. In the end, accepting a vaccine is an act that an individual performs, and it's important that we don't leave the impression that we don't respect bodily autonomy. But the two don't have to be mutually exclusive, right? We can frame in ways that put individual children's experiences in the context of our larger community. And in terms of ordering, we're recommending that you begin and stay where you want people to end up in that common good kind of frame. So here's what that might look like in a really, realistic communication. Imagine you've got a chance to provide a written commentary of some sort, like a column or an op-ed. In that scenario, you have lots of choices about where to start, how to position it, and what to say. On the left, here, as pediatricians, we're speaking up about the facts, not to scare you or coerce you, but to emphasize the importance of vaccinating your child. We know the decision can be emotional, but should you have doubts, please discuss these with your primary physician. This is speaking to an individual. It says you, right? And it's reminding people of the controversy. And it's telling people an individual action to take. Talk to your doctor. On the plain side, we're making an appeal to the common good. It uses first person plural pronouns, our immune systems, not your child. And instead of using our limited and precious communications opportunities to talk about the controversy, which essentially is reminding people of something we wish they'd forget, instead of doing that, it offers a plain language explanation of how widespread immunity works. So this is one of the shifts we're recommending. Second recommendation is to talk about improving vaccination access as a public health measure that prevents foreseeable problems. Now, I know many of you have been framing in terms of prevention already. Good news, it's a good idea. Keep going with that. But I want to draw your attention to the first part of this recommendation. We found that framing in terms of vaccination access was really important, and in some ways, a better frame than focusing on vaccination uptake. Shifting the frame to focus on our collective responsibility to provide children and families with equitable access to vaccines. That's what this recommendation is about. And let me explain a little bit more about how we got there. So when it comes to children and adolescents in particular, members of the public assume that all kids have free and universal access to vaccination services because schools require vaccination for enrollment. In focus groups, we heard people generally assume that youth vaccinations are covered fully by health insurance plans. And we heard people, acknowledge, people know that there's inequities in healthcare access or inequities in access to healthcare, but they generally don't understand why, how those exist, or what would keep a kid from getting vaccinated. People just don't see the practical barriers. A parent can't take a time off from work. Families don't have a medical home. They don't have reliable transportation to get their child or adolescent to a clinic. So those are the sorts of stories that we are recommending that healthcare voices bring into public consciousness. So to talk more about the importance of access to our overall vaccination situation. Order matters, explain those barriers to access, like the ones I just mentioned, especially for children and adolescents. Talk about why not everyone has access before mentioning any kind of disparities regionally, politically, by racial or ethnic group. Talk about the barriers before the outcomes, before or even instead of. Expand people's understanding of the systematic issues at play. Talk about the policies, whether that's Medicare unwinding, Medicaid unwinding, sorry, or school mandates, whatever the local policies are. We should be talking about the systems at play, not only the psychology of families who are or are not getting vaccinated. And it's important to emphasize collective responsibility, being explicit about how we as a society, it's on us to provide and improve access to vaccination services for all children. The way we talk about that collective responsibility is really important. We tested 2 different ways, well, more than 2, but I'll just focus on these 2, and how to talk about what we should do. We could talk about whether we are failing to provide access and not making it easy, or talking about we have a responsibility to provide access. So kind of a action or a responsibility frame. What are we doing or not doing? What do we have a responsibility to do or not do? And we found when we looked at this through a national survey experiment with a nationally representative sample, that it was much more helpful to take a forward-looking stance with that responsibility frame. Here we tested, again, those 2 messages against a set of policy batteries and attitude batteries, different questions that got at the sense of whether or not vaccines were seen as beneficial for children. Would increasing vaccine access have collective benefits? Would it be good for society? And do people support structural changes to increase vaccine access and uptake? And what we found is that talking about how we're failing to do the right thing statistically was the same as saying nothing, but emphasizing that sense of shared responsibility and saying it's on us to meet our obligations to children by making access to vaccines free, easy, widespread. That was what moved people on these issues. So we want to encourage that as a framing strategy. Still moving through here, and I see a couple questions about whether or not I'll share the slides. Yes, we absolutely will. We'll make the recording available. So in general, the next one is talking about, instead of talking about protection from disease, which people already know, make that benefit more concrete and more kid focused by talking about how vaccines keep kids prepared. It's a platform for healthy childhood, healthy development. This is about talking more about the long-term well-being that child vaccinations promote. So we saw, you saw some of this in the video, but we also saw it in our research that people think a lot and talk a lot about risk taking center stage. And that finding isn't unique to us. Other researchers in the space have found that risk and reward thinking really structure thinking about vaccine acceptance. So while that's not a new finding, I think we do have some fresh insight into what that means for communications. Most people in longer interviews, they express favorable attitudes and beliefs towards vaccines. We know that most Americans do the same thing. They agree that vaccines are an important public health measure, important for personal health, all of those things. But once they begin to think aloud about vaccines, we noticed that talk disproportionately focused on possible risks. We identified a real disconnect between what participants explicitly said, the risks associated to vaccines are minimal, and what they implicitly thought, which was basically that risks associated with vaccines are a real issue that needs to drive decision-making. And our evidence for that was people were always relying on gambling scenarios to describe their decision-making process or to imagine the decision-making process of others. They talked about playing the odds as to whether a vaccine will prevent them from getting sick, talked about it as always a crapshoot or a gamble as to whether or not a vaccine would give you a harmful side effects. So that tells us something that the risk is really present in people's mind and affects their, it may or may not, they may decide for themselves, okay, I'm comfortable with that risk, but they are reluctant to support policies that maybe put that risk on other folks. They feel like other people should be able to decide for themselves as well. So on the other part of that risk reward scenario, while the risks are really concrete, the rewards like the smoke and the picture are ephemeral, right? Very intangible. People think about health as the absence of illness. And they think, well, that my default state, our default state as a human is health, the absence of illness. And so as a result, when vaccines work, their effect is no different than that default state. Before the vaccine, I was healthy. After the vaccine, I'm healthy. There's not a concrete change. There's no visible or perceptible benefit. And so in this way of thinking, illness or the undesirable side effects are a clear departure from that assumed default state of health. And those are tangible where the benefits are intangible. As a participant said in our interviews, we asked, how do you know if it works? Well, that's a good question. How do you tell if it's been effective? Because how do you know if you've come in contact with it and fought it off? You only know when it's not effective. So our recommendation is to focus much more on how the vaccines have a tangible benefit for children by keeping them in school, keeping them engaged with their friends, keeping them, doing their sports, learning, thriving, being with family. So making that much more concrete for folks. So here, this is the type of shift we'd recommend. I think this is the first line of a whole lot of different public health pages on immunizations, that on-time vaccination throughout childhood is essential because it helps provide immunity before children are exposed to potentially life-threatening diseases. So this is the type of message that we found. It's not that it's actively bad, it's not backfiring for people, but it's not moving anything forward. It kind of just has yeah, we knew that. On the plain side here, we found that focusing, again, that concrete platform for healthy child development moves the needle. Vaccinations prepare children's immune systems to recognize and resist contagious diseases, keeping them healthy so they can keep growing, learning, and thriving. That type of story is one that I know that pediatricians, school nurses are already keep telling it, connected to vaccinations. All right, and my last point before I hand it to Deborah is essentially to talk a little less about vaccines and a little bit more about our immune systems. And specifically, we found two metaphors that helped people make sense of this and make the role of the immune system come alive and be concrete for folks. One is a metaphor of computer updates. The other is a metaphor of literacy. These are more effective than the metaphors that folks come ready-made with. You heard in the video how when people have a war scenario, lots of military language, fighting, battling, shield, we found that when we rely on military language and those ways of thinking, people conclude that the shield failed if there's any transmission of disease. Only the vaccines that have completely eradicated disease are the work. This helps to explain some of the resistance or distrust or just feelings about the flu vaccine, for instance. And so this language keeps us locked in the conversation we're already having, where we need to break through the current conversation. And when we compare vaccines to medicine, we heighten people's concerns about side effects. It gets really personalized. Just for that person, is the risk and the reward scenario okay? If we switch to vitamins, we found that had people thinking and talking about boosting immunity naturally through ginger or garlic or whatever that may be. So we want to ditch these metaphors, and we have two that we found really work differently. When we compare vaccinations to computer updates, we call up, strangely enough, productive associations. I don't have productive associations with updating my computer, but our research found that it gets people to think about prevention, ongoing maintenance, and protection against network threats. You can say something like, getting vaccinated is a lot like updating your computer. Our computers function best when they are protected from network viruses, and we have the latest antivirus software update. Vaccines are like software that has information for our immune systems to improve their performance. They prepare children's bodies to detect viruses and other diseases so the immune system is ready to respond and resist. So this metaphor acknowledges that viruses exist and present a threat, while also presenting a simple, straightforward solution of updating the immune system to minimize those threats. That leverages people's strong desire to limit threats. And so it shifts the emphasis of what's limiting the threat from the vaccine it just shifts it to the limiting the virus from spreading. This metaphor we found was particularly effective with parents and in giving parents a way to think more collectively and think about collective benefits. It made them more likely to agree that high vaccination rates overall are necessary to prevent the spread of a disease. And then another one is using the metaphor of gaining literacy to emphasize how the body's immune system learns to read the language of a virus from a vaccine and increases its ability to be prepared. So to use this metaphor, you might say something like, when we immunize children, it's a lot like helping them learn to read. The vaccines are the beginner text that our bodies use to practice comprehending a virus. A literate immune system can help keep kids healthy so they can focus on kid stuff like reading the books they love. This metaphor really reduced perceptions of vaccine risk overall, and that was especially true for parents in the sample in our national survey. And as we mentioned, reducing perceptions of vaccine risks is vitally important, given that it has such a big part in people's thinking. I'm going to show you next a video of one individual. Is some of our metaphor testing and how the metaphor influenced her thinking. There's the first 45 seconds or so of the video is her thinking, just her default thinking without any framing, where she started. We introduced the video, and you'll see how it shifted her thinking. Not everyone's shift is this dramatic, but I want to show you that the shift can be this dramatic.
I personally have not been vaccinated. I did have, the latest, what we're discussing, what's been going on in the world about COVID. So I have built up antibodies. Explaining how it works is basically having the health system incorporate certain medicines, I guess, that can combat together. The risks, I would think, is kind of like what's going on now, even though, people have had their second shots, and now because of the new strand, now they're getting boosters. So, so now you had Delta, now you have Omicron. I mean, what else is going to come? And you're just going to have to keep boosting and boosting and boosting. Whereas before, like for, let's just say the flu, I just get one shot for a year. I don't get a booster. Of course, I don't get the flu, but that doesn't necessarily mean that the shot worked. And because I haven't been vaccinated, I can't really say that I'm at a big risk, because I've been doing pretty good without it. It makes sense that it's just like reading and writing. It's just giving you the ability to increase your knowledge, your body's knowledge. So your body is getting more knowledgeable as, like in reading and writing. As a child, you're growing in what the aspect is of your body. So your body is growing and knowing, that it's getting better in deciphering what the benefits are. About the risks, God, kind of looking at that, I really don't see that there's any risks. Your body is like the student, and the vaccine is like the teacher giving you what you need to learn to read and write. That's pretty interesting. Okay. I really kind of like that aspect.
Okay, all right.
Kind of got my mind kind of going differently about this vaccine.
Okay.
I love that video. Again, it is one person. This research was done with dozens of folks in that research setting and thousands of folks in the survey experiment. Again, that's a real strong response, but it can be that strong, and you can see how it shifted the emphasis, shifted thinking from the risks and tangible risks, unclear rewards, to a focus on prevention, reducing thinking about risk and thinking about benefits. So overall, less of talking about helping people recalculate their risk reward scenario, and instead focus on the common good. We want to talk about equity instead of reminding people that some groups aren't getting vaccinated. Remind them that it's on us to ensure that everyone who wants to be vaccinated, that access is free, easy, widespread. People know that vaccines can prevent disease. We need to freshen up the story and make the rewards more concrete by talking about how good health is a preparation or a platform for healthy childhood development, and a shift from the vaccine to the immune system. What's ahead? Cameron has shared the resources that we have already. We are hard at work at a practical toolkit, very shared, very focused on how to use these messages in advocacy. In the next couple of weeks, I'll be doing a workshop at the AAP Advocacy Conference. We'll be giving a similar webinar for the Association of Immunization Managers. And this work is already underway. Dr. Chung is using it in her messaging, AAP is using it, and the National Association for School Nurses is using it. And so I will turn it over to Donna now to talk a little bit about what this work has been like and how it's been helpful for her network. Thanks so much. Over to you, Donna.
Tour of this essential research. I also thank the American Academy of Pediatrics for sponsoring this framing research in such a way that allows it to be a gift to the field. We have shared it with school nurses who collectively serve over 50 million students and families in public and private schools across the nation. We know that, like pediatricians, school nurses are seen as a trusted source of information for families when it comes to children's health. School nurses are also influential on health practices and policies at the school and district levels and even beyond. A story of one of our members, a school nurse leader from South Carolina, comes to mind. In 2021, she realized that many of her coworkers were hearing things that were undermining their confidence in the COVID-19 vaccine. She persuaded the state school board to support a statewide education campaign that, among other things, led to a majority of her school's personnel voluntarily receiving this important immunization, something that can't be said about many schools in similar policy contexts. So in addition to talking with families with one-on-one vaccine counseling, school nurses are an important voice in public policy in the public square. Because the clinical conversations and the cultural conversations influence each other, it's critical that we have effective communication strategies that equip us for whatever conversation we're having. The National Association of School Nurses has been using the framing recommendations in our work, a project we have called Champions for School Health, which aims to increase confidence and uptake of the COVID-19 vaccine. This project is financially supported by Kaiser Permanente, and we lead it in partnership with the Institute for Education Leadership. We've been using the cultural insights and framing recommendations in 9 states: California, Colorado, Georgia, Hawaii, Maryland, Oregon, Virginia, Washington State, and the District of Columbia. These locations are quite different from each other, yet we know the same concerns and questions come up again and again in all these places. That's why national research like this can be so helpful. Frameworks worked with the National Association of School Nurses to apply the findings about Americans' mental models of childhood vaccinations to a motivational interviewing guide for school nurses. With this tool, school nurses can quickly make sense of the mental model that is driving a family's question or concern and they know where it's coming from and they can respond with a well-matched reframe. The nurses we've heard from have said how helpful it is to have a coherent strategy for responding, knowing the right thing to say at the right moment, and just as importantly, what not to say. We've been pleased but not surprised with the warm response to the new framing this research uncovered. It really does offer us something different, a fresh look at a challenge we've all been facing for too long now. We've shared our materials with partners across this sector, from school nurse leaders to the CDC's Division of Adolescent and School Health. People have asked if they can use it, link to it, or share it. The answer is yes to all of the above. So far, the motivational interviewing resources have been accessed over 2,500 times and counting, and we know that they are being put to good use. Our framing project focused on motivational interviewing, but we're looking forward to seeing the advocacy-focused toolkit that's underway. We all know that our daily work in the clinical setting is shaped by broader cultural and political contexts. It's critical that we do all we can to drive a child-centered, science-based discourse about childhood immunizations. I'm excited for this framing strategy to radiate out from AAP to organizations like NASN and beyond. I imagine an ever-widening circle of voices speaking with more confidence and more impact because of this research. At the end of the day, the more places that families can hear well-framed messages about how immunizations keeps kids healthy, thriving, and focused on being kids, the better. I'll hand it back to Nat now to lead our discussion period.
Great, and thank you, Donna. It's been just a real pleasure to partner with you and your colleagues, and really appreciate those comments. And Julie, what a great presentation. There's many comments in the chat. Most of them are expressions of appreciation for this research in your presentation. I won't elevate those up out of the chat, but I'm sorry, Julie, but you should definitely have a look in there. So I think we've got about 7 minutes. I'm gonna do 2 questions, one at a time. The first one, which is something that I'm really interested in, and I've heard you talk about, Julie, and I know you've got some opinions and some ideas here, is from Yoan Young, who asked kind of a question about misinformation and conspiracy theories, conspiracy theory thinking, and whether you could talk a little bit about this as a challenge on this issue, and kind of how the work that you've presented might help people navigate, respond, navigate or respond to these challenges that are so front and center on this issue, not on this issue alone, but on this issue in particular.
Yeah, it is a real challenge, and we need strategies to deal with it. I think one thing that can be helpful for us as communicators is to think about, are we in a public setting where we are directly in conversation with, say, imagine two voices on a town hall, where your co-panelist is a purveyor of conspiracy theories? Are they an active vaccine denier in a public setting? There's one set of strategies for that. And there's another set of strategies for responding to an individual, perhaps, that has been influenced by these conspiracy theories. So in that public square and within the resource that Donna shared, we do have a set of strategies for doing that public facing work. And I would encourage you all to click into that link that Cameron added. That really is about naming the strategy that they're using. So you're using cherry picking statistics, or you are using a worst case scenario or fear mongering, right? And what we have found, I want people to understand what's true about this issue and then to state the truth, right? So you're not restating the myth, and you're working to discredit the conspiracy mongerer by naming their strategy and then offering a different way to think about it. In the clinical counseling setting, in that motivational interviewing setting, it might be more effective to say something that's like, I can see you really care about your child's health, and you're reading and listening a lot about this. Would it be okay if I shared what I've learned about this topic, which is a very different way of responding? And yeah, I'll make sure we get the link in there in just a moment.
Great, thank you, Julie. I think, we can, and I've heard Julie give whole presentations on kind of misinformation and surrounding issues. So would love to kind of follow up with folks and hear if people have any additional questions on that, which I'm sure people do. The second question that I wanted to bring up, which I think is a really fascinating one that I also think you have things to say to Julie, is a question from Vicky Shabo about this kind of common good framing, kind of shifting from individual to collective benefits. And the question is about kind of the challenge of people individualizing benefits and the direction that that leads in terms of people's thinking about policy is not, it's not restricted to issues of childhood vaccination. So the question is kind of about the generalizability or exportability of that as a strategy that we could use to kind of think and use in our framing on other issues.
Wow, that's a really good question. I mean, I think we have found again and again across, the decades worth of research I've been tracking closely here at Frameworks, that basically if you want a public response, you got to talk in terms of public benefits, right? So it can often feel easier to appeal to people's sense of individualism and their individual health or the individual benefits. But that, again, that doesn't translate to the issue, right? They may take action X, Y, or Z, but often it is only actions that benefit them and their loved ones. So if you want folks to support policies, you got to talk in a collective good, common good, some flavor of that. I saw another question in the chat about we live in such an individualistic society. Are you sure common good works? And the answer there is yep, we checked 5 different ways. And it's because, yes, of course, we do have a very individualistic society, but we have both ways of thinking available, right? Individualistically and collectively. The individualism gets dosed and increased and repeated every single day throughout our society. Our job, our voice, our contribution to shifting the discourse can be to be a more present space, a more present voice, reminding people of common good, collective responsibility, collective obligations.
That's great. And I'm not going to frame this as a question, Julie. I'm just going to highlight it out of the chat because I think it's really important that people hear it. And I'm not sure we have an answer to it. That's the other reason I'm not going to frame it as a question, but there's a question from a longtime colleague of ours, Nancy Lundenberg, who asked about kind of what we think about the kind of exportability or the ability to take these findings, which are really specifically on childhood vaccinations, and use them as a way to think about strategies and more productive communications on adult vaccines and vaccinations. I'll give you just a second to talk to that, Julie, if you'd like to.
We do have good evidence that these will work across the age span, across the lifespan. We started the project scoped very broadly. People wanted to talk about vaccinations generally. In the conversations, we had to push them, kids, what about kids? What about kids? Because we wanted to make sure we got to that. So there's nothing in this that makes me think that most of these strategies wouldn't work for adults. Probably the part about keeping kids healthy and focusing, on learning and thriving is that's specific to kids, obviously. But in general, I think the other things are portable.
Great. And there's I can't do it because we're out of time, but there's a really great comment that just got dropped into the chat. I'd encourage people to check that out. So Julie, I'll hand it back to you to kind of bring us home here, and just want to thank you again, Julie, for a great presentation, and for our other speakers as well for really adding to our time here.
Yes, absolutely. So thank you for everyone who's been here. Absolutely. Access the resources. We will be sending a follow-up email that has the slides, the recording, as well as the different resources that we've mentioned. So if you're like, where's the link? It's coming. And please, please, please share this information with your colleagues and networks. Get in touch with us if you know a network that could be making good use of this work. And I'll just end by saying this only works if and when we create that ever widening circle of voices, like what Donna said. So thank you to AAP for the vision and the leadership and making this research happen. We started having our first conversation with AAP about this in 2018. And so I'm glad it's finally here. Thank you, NASN, for being an early adopter. And thanks to the rest of you for being our next early adopters. Frame on.